As for my topic today, we're discussing about the dysfunction of the pelvis organs and the spinal cord injuries. So, firstly, we have to understand its definition by saying that the pelvic organ and the spinal cord injury, SCI, is the damage of the pelvis and the spinal cord that results in the loss of the function and the mobility or feeling of the body. So the spinal cord is damaged to the okay, this is mistake here. Okay, the spinal cord is damaged to the spinal cord, causing the temporary and permanent changes in our body functions. Like, for instance, we can say locomotion, even part of speech. So some of the symptoms may include loss of the muscle, as I said, sensation and autonomic functions in parts of the body are served as the cerebral cord below and its levels of injury. Mhm. So types of the spinal cord injuries, we have two types. The first one is a complete one, and another one is complete. By complete, we to fully understand that this person can be paralyzed or there may not be any no function at all. So let's get into it. So you can say the spinal cord above is the first thoracic vertebrae, or within them, cervix section of C1 to C8 results in some of the degrees of the paralysis in 4 limbs. That means in all the limbs they're being paralyzed, which is the legs and the arms. So the injury below, which is down apart from the thorax to the level to the T1 to L5, which is the limb, are able to fully use their arms and hands, but the degree in which their legs or disabled depends on the injury. Completely paralyzed is described as the permanent loss of the motor and nervous function at the T level 1 and below the residing of the lost sensation and the movement in the legs and the uh, bowel, bladder, and sexual organs. Moving on. Whereby incomplete it describes the central cord syndrome. Causes the injury of the, for instance, we can say edema of the central cord, usually of the uh, several and area and several sensations. Its characters, it's a motor indifference, which is the upper experimenters sensory loss of variations in the upper extremities. Anterior cord syndrome, it's caused by acute disc and imitation action within the fractured dislocation vertebrae and also occurs injury to the anterior spinal artery and lesion. Its characters that we can say loss of pain, temperature, and motor function is noted below the levels of the lesion of injury. For instance, we can say light touch, position, and also the vibration sensation remains intact. Whereby in the posterior cord syndrome, its cause is by infraction of the posterior spinal artery and it's caused by lesion of the posterior uh, portion of the spinal cord. Its characters can be a loss of the or loss of the prepositive sensation, fine touch, pressure, vibration below the lesion, deep tent at areflexia. Continuing, and here it's just the same explanation. Like there are several types of them. There, the first ones I've already said them in the above areas. So let's skip next. So This could be some of the signs and symptoms for our patients that may come to us or tell us what they're feeling. Like, for instance, loss of movement in the limbs, weakness, or paralyzed, difficulty in walking, numbness, reducing sexual function, loss over control of bladder. So we may, as a doctor, we may group them according to whether it's complete or incomplete type of injury. Continuing. So these are some of the clinical manifestations whereby we can find spinal shock, autonomic dysreflexia, some pain, difficult breathing, sensation in the stimuli, muscle spasm, loss of sensation. We have loss of bladder control, even bone, and sexual diffusion, and loss of the function such as mobility. And diagnosis ways in order to find out on what is going on. We may use through X-ray, we may use a blood complete account, whereby you can check on the arterial blood gas levels and also like the oxygen and also the carbon dioxide. Since we mentioned that they can have breathing difficulties, and we can have the computerized topography, which is like a scanner to see what is going on, and we can have a magnetic Rosemas image and the myelography. Continuing. Bye. Thank you.